morning. My name is Andrea Reyes, and I'm a health educator from the Columbia University Cancer Center up in Upper Manhattan on Broadway and 168th Street. I've been teaching in the community for many, many years. I have a workshop for you today that's going to be all about how to reduce your risk for colorectal cancer. And I work in the Community Outreach and Engagement Office at Columbia University's Medical Center. So we'll learn a whole bunch of different things today. We'll learn about what exactly are the colon and the rectum, what is colorectal cancer, what the risk factors are, who should be checked out, who should be screened for this type of cancer, what the screening tests are, what all the options are, and how you can lower your risk for developing this type of cancer. So here are some facts. Colon cancer is the third leading cause of cancer deaths in the United States and among New Yorkers, but it's a cancer that can be preventable if what causes it are removed. So I'm going to talk more about polyps. Polyps are something that you can get in your intestines, and if they are removed, then what can turn into cancer is removed, and that's how we can prevent cancer in the intestine. Polyps are not harmful little growths in the colon that can change over time into cancer. And the reason that you get screening tests is because you want to find and remove the polyps, right? And that prevents colon cancer. And if someone has something, you can find it early when treatment works best. So the colon and the rectum are part of the digestive system. Food is digested in the stomach and small intestine, and then it moves to the colon. The colon absorbs the water, and the waste, the stool, moves into the rectum until you're ready to go to the bathroom. And this is it right here. The rectum kind of holds it, and then when you go to the bathroom, it comes out of there. The colon is a big tube. It's 5 to 6 feet long, and it's also called the large bowel or the large intestine. It's got different names. Now, these are the polyps I was talking about, right? So colon cancer is a type of cancer that begins in the colon, and rectal is a type that begins in the rectum. And the colon cancer usually begins as small clumps of cells that are just damaged and not acting right. And they will form these things called polyps. And this is what polyps look like. They look like teeny, teeny little fingers that are growing in the lining of the intestine. Polyps in and of themselves are not harmful, but the harm comes when they turn into precancer or cancerous cells. Not all of them will turn. You can have polyps and definitely never get colon cancer, but if you have polyps, you definitely want to have them removed. If you hear of relatives saying that they have polyps and you have not had a colonoscopy, you definitely want to try to have one because they do sometimes run in families. The picture on the right is big. It looks almost like a tongue or something inside the intestine here. This is a cancer that has grown quite large and is spreading through the intestine. And it's a lot easier to go in and remove polyps than to remove a tumor this large. What the doctors would do is actually cut a piece of your intestine, and then you would have to have treatments like chemotherapy and other medications to make sure that this cancer that is spreading has not spread to other parts of the body. Rectal cancer is cancer in the rectum. I know these pictures aren't pretty. I apologize, but it's good to see these things so that one can know this is what a tumor can look like in the rectum. And there are some risk factors for rectal cancer. If someone has polyps, right, or previous colon cancer, and smoking can affect the cells in your intestines, right? And so can a very high fat diet. So we want to make sure that we can modify those things and not breathe in smoke and have a low fat diet. These are some risk factors. Some of these things you can do something about, and other ones you cannot, right? So you can't help but getting older. It tends to be found in people that are older. It also tends to be found in people who have a family history, or if they've actually had it before themselves, right? So the genetic mutations can be passed down throughout the family. Colon cancer is higher in people who are of African descent and in African Americans. We don't know exactly why that is, but that is a fact, and it's being studied. For people who have inflammatory bowel disease, which is diseases that cause inflammation of the cells in the intestine, they are more likely also to get colorectal cancer. Diabetes is a risk factor. These down here you can do something about, right? So drinking alcohol will affect the tissues in your intestine. So will cigarette smoking. So will eating red meat or processed meat. And being obese will also affect you. Having high cholesterol, it influences the growth of certain cells in the intestines, which can accelerate the growth of a tumor if there is one. Things that decrease your risk: being physically active. The more you move, actually, the more you go to the bathroom. So if you are able to move as much as possible. Sometimes the doctor might say, for this condition to lower your risk, take an aspirin every day. Don't do it unless you have doctor's permission, please. Of course, polyp removal is the biggest way that you can decrease your risk. Eating whole grains and fiber and dairy, all of that also helps you to go to the bathroom, right? The fiber is really good for you. And the doctors sometimes put people at really high risk on combination hormone replacement therapy. What you can do to reduce your colorectal cancer risk, always do throughout your life. Keep a healthy weight, limit the alcohol, don't smoke, limit the red and processed meat. And so I said this, right? The regular exercise and the eating healthy. So everyone starting at age 45 should go get screening for this. And you do that starting with a colonoscopy. So if you guys haven't had one, or if you have family, friends, spouses, anyone in your life who by age 45 hasn't had a colonoscopy, or might be 50 or 65 and has never had one, you might want to talk to them about what you're learning today to see if we can get them into an appointment. People younger than 45, they can go if they're having stomach problems, if they have other conditions, or if it runs in their family. You can go to your doctor and say, look, this is what's going on. And they may get you the appointment. You know, you can have that conversation with them. And so anyway, so people can start at age 45 and typically go to about 75. And after that, they stop. Sometimes people's intestines become a little thin when they're much older. The doctor will determine when you should go and how often you should go, depending on in general, your health condition. And so we'll talk about colon cancer screening tests, right? So what a screening test means that you're checking the colon and the rectum for cancer before you feel it, before there's a problem, when it might just be not cancer, but a polyp or 2 or 100, depending on the person. And so again, average risk people should start going at 45. And these are I'm going to show you the options for the screening test. So people sometimes decide to take these take-home little box fecal tests, and you do those once every year, or to do the colonoscopy. I always advise, or it is always advised, to start with the colonoscopy first so that you get a baseline and you get any polyps removed. In case you haven't seen these or your doctor has not given these to you, these are the little kits. You get a list of instructions. The doctor will explain to you exactly what to do, and then you go home with the box. When you go to the bathroom and you have a bowel movement, you take samples of the bowel movement and put them either on cards or in the little jar, and you wrap it all up. You follow the instructions carefully, and you mail it to the laboratory, to whatever instructions are on the box. That laboratory will analyze the cells inside of the sample that you provided. And if there's anything abnormal on that test, the doctor's going to ask for further testing, usually a colonoscopy, to make sure that you are okay. Okay, so anyone not receiving these boxes who is over the age of 45, if you have relatives or friends that have never even seen this, they can go ask their doctor for the take-home fecal test, or the colorectal cancer screening little box, or the FIT kits. And so depending on the institution and your insurance, these are the most popular ones in New York, and these are the ones that are used. So any one of these is fine. The home test kits, what they look for are red blood cells that might be in your intestines and in your stool because you might have a tumor. The Cologuard is another one of the test kits that looks for DNA from the tumor. It's easy to miss. It's good to have the test, but the absolute best thing that you can do for yourself is to get the colonoscopy. And then it's once, they might tell you, look, you don't have to come back for another 10 years. You don't have to worry about it for 10 years, but at least it's done and there's a baseline. And the kits are just every year as a follow-up, just to make sure there are not cells that shouldn't be in your stool in there. Colonoscopy screening, right? So what is that? For those of you who don't know, first of all, you're under anesthesia. You don't feel a thing. Probably the most difficult part, and I'm sure some of you have heard, is that you do have to take a laxative and eat very light in the days before, and take a laxative the night before, because your intestines have to be clean so that doctors can look in and see everything that's inside. So during the colonoscopy, the scope, the tube with the tiny camera at the end, goes in through the rectum. It goes and checks out your whole intestine. The images are projected on a big screen. The doctor can see inch by inch what's going on in your intestine and can identify any problems. They can take biopsies of polyps. They can take samples of anything that's needed in there. And it's not just for polyps. You know, someone can have an ulcer, they can have scar tissue, they can have an infection. There are a lot of things that can go on in the intestine, and the doctor is looking for all of those things during the colonoscopy. That's why this test is so good, because it really shows the doctor visually what's happening inside of you. So you're going to get a set of written instructions from your doctor, and they'll tell you things like, from 2 days before, start eating really, really light. The day before, just have juices, jello, some broth. They'll tell you exactly what you should and should not eat. They will give you either tablets or a gallon of liquid or a little bottle of bubbly stuff, and that's the laxative. And they will ask you to drink it, and you start drinking it in the afternoon. You'll be going to the bathroom probably all evening. You'll go to bed. In the morning, you wake up and you go to your appointment. I always recommend to try to get colonoscopy appointments in the morning, because you will be empty, you will be hungry, and you don't want to be hungry all day and then go in at 4 o'clock. So a good kind of practice is schedule it in the morning, and you go, you get to the hospital, they'll set you up, you'll get a bed, and they'll give you an IV with anesthesia. The process, it really varies, but it's actually quite fast, and you're done within 2 hours or so. And then you just go to recovery room and you just lie there till you wake up. Somebody has to pick you up from the hospital. That's just the law, because you will have had anesthesia. So someone has to walk out with you and get you home. And that when you get home, you can just have a juice, have some crackers. And then a few hours after that, you're back to eating normally again. So that's like the entire process. Anybody that goes to the bathroom and sees black stool should, that same day, that moment, call their doctor's office just to get checked out, because that's important. That's an indicator of something very serious. Polyps are removed with a little hook. Very simple. They just take it out. If during the colonoscopy your results are normal, the doctor will come and say, look, come back in 10 years. If they're not, he might say, look, come back in a year, come back in 5. But it's always a doctor who's going to decide, depending on what the doctor saw, when you should be coming back. For the fit kits, people can get those from a GI, or they can get them from their primary care if the primary care has them. If they don't, you can ask them where you can go to get these kits. But for the procedure, yes, it has to be done by a specialist, by a GI. If you can, and there were no issues with the previous site, absolutely go back, because then they can have a history. If you have different insurance, if you've moved, if you're in another state, you can always call the initial site and get your records transferred over to the site where you're having the current colonoscopy. But it's always really important. They want a history over time. So if you were fine before, that's wonderful, but they should still, the people doing the colonoscopy now should still see that. If you had polyps, or if there is in the record that you had an issue of any kind, it would be good to let the current doctors know if you're deciding to go to a new site. So just some things to remember. Colon cancer is one of these cancers that can actually be prevented. Anyone 45 years or older should be screened. Talk to your doctor about which test is right for you, right? Because it may be that this test may not be right for you, but there are options. So you always want to discuss, is this going to work for me in my body? And, the most important thing is that you can lower your risk or prevent colon cancer. If someone has had any, and I teach all cancers, any cancer in your family, please report it to your doctor, because sometimes the doctor might say, you know what, hey, do you want the genetic testing done? Or let's check you out because certain people had cancer in your family. So for example, for breast cancer for women, sometimes there's a genetic link. It's important to make sure your doctors know that. For men, prostate cancer tends to run in families, especially in families of color. If someone's dad or grandfather had it, that man right now should absolutely mention it to his doctor. So it's for both men and women. So it's important to know those things for doctors to know. Here are just some resources for people who want to start getting the fit kits and they don't have health insurance. We have a Manhattan Cancer Services program at York-Presbyterian, Columbia University Medical Center. And the number that you can call to ask for an appointment or ask questions is there below. It's 212-851-4516. For people with health insurance, if you're looking for a colonoscopy over at Columbia, you can call the Center for Digestive Health, and the number is 212-342-1155. I really like cancer.net. They take each cancer, it's like on one page. The breakdown is really easy to read. So cancer.net is an excellent resource for learning about any type of cancer. The American Cancer Society's website is also like the website for all things cancer here in the United States, and always the CDC. If there's like a health question, the Centers for Disease Control, CDC. So those are three excellent health websites. And I understand, I'm always worried because I teach so many of these classes in the community, and a lot of people do have misinformation, or they're learning about things on TikTok. And I'm like, no, we need to make sure that the source is legitimate and written by doctors and scientists, right? So please refer to these three sites if you want to Google and look things up. These are legit and they have accurate information.